A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a significant policy shift, the Trump administration has announced the rescinding of Biden-era guidance concerning emergency medical care for pregnant patients, particularly in relation to abortion services. This decision comes in the wake of the Supreme Court's controversial ruling that overruled Roe v. Wade, effectively ending federal protections for abortion rights in the United States. The guidance, originally issued by the Department of Health and Human Services (HHS) in July 2022, mandated that hospitals must stabilize patients in need of emergency care, which included the provision of abortions in certain circumstances. Under the Emergency Medical Treatment and Labor Act, EMTLA, healthcare providers were required to perform necessary medical interventions to stabilize patients, even in states where abortion laws are restrictive or outright prohibitive. The guidance specifically highlighted emergency medical conditions such as ectopic pregnancies, complications from pregnancy loss, and severe hypertensive disorders like preeclampsia as scenarios where abortion could be deemed necessary to protect the health of the patient. EMTLA, enacted in 1986, was designed to ensure that all individuals receive emergency medical treatment regardless of their financial situation. Hospitals that failed to comply with these requirements risked facing civil monetary penalties. However, the recent announcement from HHS and the Centers for Medicare and Medicaid Services (CMS) has effectively overturned this guidance. The agencies stated that the previous policies do not reflect the current administration's stance and emphasize their commitment to enforcing EMTLA in a manner that protects individuals seeking emergency care. CMS will continue to enforce EMTLA, which protects all individuals who present to a hospital emergency department seeking examination or treatment, including for identified emergency medical conditions that place the health of a pregnant woman or her unborn child in serious jeopardy, a press release from CMS stated. This move has drawn sharp criticism from abortion rights advocates. The American Civil Liberties Union, ACLU, condemned the administration's decision, asserting that it undermines the health and safety of women. Alexa Colby-Molinas, deputy director of the ACLU's Reproductive Freedom Project, expressed her concerns, stating, "By rescinding this guidance, the Trump administration has sent a clear signal that it is siding not with the majority, but with its anti-abortion allies, and that will come at the expense of women's lives." The Biden administration's guidance had faced legal challenges, with a federal appeals court ruling in January 2024 that Texas hospitals and doctors were not mandated to perform emergency abortions despite the existing guidance. Additionally, earlier this year, the Department of Justice dismissed a lawsuit against Idaho, which had been accused of violating EMTLA due to its stringent abortion laws. The ongoing debates and legal battles surrounding abortion access in the U.S. continue to stir significant public discourse, with advocates on both sides of the issue mobilizing to protect their respective positions. As the political landscape evolves, the implications of these policy changes will undoubtedly have lasting effects on healthcare access and reproductive rights across the nation. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.